Welcome to Shri Medical College. Today we will explore dialysis at home, the benefits and challenges of home hemodialysis. Normally functioning kidneys filter the blood of excess fluid and waste. Kidney failure leaves only the options of a transplant or continual dialysis to restore the organ's function. Hospitals offer dialysis, which involves frequent kidney unit visits, often 3-4 hour sessions each week. Home dialysis is more convenient for patients. Hemodialysis can remove waste and surplus fluid in the absence of functioning kidneys. This technique uses a dialyzer, an artificial kidney. Dialyzers filter blood and return it to the body through plastic tubes. Each treatment begins with 2 needles entering your access. Using these needles and plastic tubing, blood is drawn from your veins and sent to the dialyzer. A little amount of blood is exiting your body at any given time. The dialysis machine pumps blood and controls treatment length, temperature, and pressure. Dialysis clinics use larger machines than home users. If this dialysis approach works as stated, you can schedule your treatments whenever you like. You must follow your doctor's weekly session schedule and session length. Dialysis is usually performed at a clinic, but there are instances in which it can be performed at home. Many experts agree that hemodialysis or peritoneal dialysis performed at home is the best way to manage renal failure in the long run. Home dialysis improves health, schedules, and diets. Its key benefit is the opportunity to do dialysis at home longer and more often than in a clinic. Patients who would like to continue working while having dialysis treatments frequently choose home hemodialysis, HHD, due to its convenience and independence. The therapy can be done every other night for 6 to 8 hours. Blood fluid loss increases with frequent and prolonged therapy. This could improve your mood in between treatments and provide you greater freedom in your food and drink choices. Due to the effort required to go to and from treatment centers and the pressure on family and friend ties, dialysis patients may have a lower quality of life. You may not be well enough to relax anymore. Dialysis patients' loved ones typically lament the high costs and inconvenient clinic visits. Home peritoneal dialysis is more frequent and shorter than hemodialysis. Some home hemodialysis patients may need extra nephrologist visits. Since waste and fluid build up less between treatments, more frequent dialysis mimics renal function. This consistency has reduced mortality, side effects, and outcomes. Because dialysis may be done on a patient's own schedule, they can reap the health benefits without having to sacrifice other aspects of their lives. As a result of having to spend so much time at a dialysis center, patients inevitably miss out on time with loved ones, hobbies, and other activities they enjoy. Home dialysis patients can read emails, watch TV, call family, or play games with their grandchildren during their sessions. Home dialysis patients have more time and freedom to live normal lives. Patients may prefer home dialysis to clinic dialysis. Patients with ESRD might save money on monthly transportation expenses like gas and maintenance by opting for home dialysis. Private insurance usually covers home dialysis. Due to its potential health and quality of life benefits, patients are considering home dialysis. End-stage renal disease, ESRD, patients who value treatment flexibility often choose peritoneal dialysis, PD, or home hemodialysis, HHD. The patient's lifestyle, medical needs, and medical team's judgment will determine the best treatment method. In order to determine the optimal course of action, patients who are seriously considering home dialysis should speak with their healthcare providers and loved ones. Home dialysis patients learn more about their ailment than clinic patients. Learning about and managing their health reduces fear and depression for many people. Self-managing dialysis patients have a higher quality of life and greater ability to monitor their own health because they have a deeper familiarity with their illness and its treatment. As more convenient tools for home hemodialysis become available, this treatment option is gaining popularity. Keeping these in order, clean, and sanitary is much easier. These days, you can get by with less raw materials for some equipment. If you are considering home hemodialysis, it's best to talk to your doctor about what kind of equipment might be best for you. Short-term hemodialysis can be done at home once or twice a day for 2 hours. Your doctor should recommend how often to use your medications. You and your carer can schedule your hemodialysis sessions whenever it is most convenient for you. A progressive and consistent loss of blood fluid occurs during more frequent treatments. You may notice an improvement in your ability to function in between sessions after using them even only a few times. You and your care partner have been educated on how to prevent and treat complications during dialysis. The training period could last anything from a few weeks to several months. There are several advantages to doing dialysis at home, and when you add them up, you receive an improved quality of life. Most patients who switch to home dialysis report better health, more leisure time, lower transportation costs, and a better understanding of their situation. People who choose for home dialysis, in a nutshell, get more say in their health care, their time, and their life. Better life quality results from the accumulation of these benefits. At-home hemodialysis calls for the same dialysis machine and waste disposal options seen in clinics. However, a water filtration system is also required. Home hemodialysis filters 120 to 150 liters of dialysate. The patient's blood encounters a lot of water in a year. A variety of chemicals, minerals, and even bacteria can be found in the water that comes out of the tap. The water is safe for drinking and usually has no negative effects on them. Dialysis needs ultra-filtered water. Water treatment involves reverse osmosis, charcoal tanks, filters, and bacteria-catching devices, RO. Your home will have a customized water purification system. Water from the tap is converted to RO quality for use in dialysis machines via a series of filters and pipes. You might perhaps fit this equipment into a small cabinet. Your doctor will take blood at your session to check for any changes that may necessitate a modification to your current course of therapy. Your doctor will review lab findings, medicines, and diet. The doctor will review your home medical records to verify your vitals, weight, height, pulse rate, and blood pressure. It is vital to be prepared for the questions your doctor may ask you about your health, food, and other lifestyle issues during your appointment. The social worker and nutritionist may accompany you to this consultation. While the patient sleeps, they conduct a lengthy process at home called hemodialysis. This method of dialysis can be performed as infrequently as once every other night, but at a minimum should be done 6 times per week. The treatment program suggested by your doctor will address this question. Treatment sessions often last between 6 and 8 hours. You and your care partner will train for weeks. If you join one of these clinics, a remote employee will monitor your dialysis sessions. It's possible that increasing the number of hours spent on dialysis each week would lead to a greater rate of waste clearance. Join Shri Medical College's Bachelor of Vocation in Dialysis Technology and take the first step toward a successful career in dialysis technologist. We are here to assist you in launching your career as a dialysis technologist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Medical College. Good luck, goodbye.